Now we're going to take your knee through its controlled articular rotation. So it's very common for us to think that the knee is simply a hinge joint, but when our knee is bent, we do have a little bit of rotation in either direction. So we can start with a rotational car. I'm going to take my hands and kind of lock my thigh bone into place. Then I'll flex back through my toes. Now I want to keep my eye on my shin bone. And with my hands locking my thigh bone into place, I'm going to take my left toes and foot and rotate my toes and foot away from my midline. And you'll notice here that my shin bone will slightly change position as there is some rotation happening within my knee joint. From here, I can take my foot forwards and across towards my midline, and my shin bone will move accordingly. Moving back and forth from these two positions is our rotational cars for the knee joint. If I want to add more to this, I can think about lifting my thigh bone up, locking that thigh bone into place. I'm going to pull my heel in, creating knee flexion. I'll rotate my toes outwardly. I'll extend and straighten my leg, rotate my toes in, and rebend. And I can start to make that a more circular motion as we go, and I would reverse from there. Now this is a subtle rotation, so we don't want to fight for too much range of motion, nor do we want to push through pain.